associated with the gastrointestinal system. First, let's consider medical conditions. Some common risk factors include allergic reactions to food or medications, as well as cardiac, respiratory, or neurologic disorders that can slow down gastrointestinal movement or cause constipation. Additionally, diabetes mellitus is another key risk factor because it predisposes individuals to oral candidal infections. Lifestyle and family history also play a role. Chronic alcohol use, chronic laxative use, and tobacco use can all increase gastrointestinal risk. A family history of gastrointestinal disorders, such as colorectal cancer or inflammatory bowel disease, is another important consideration. Other contributing factors include chronic high stress levels and the use of certain drugs like NSAIDs. Swallowing disorders, such as those seen in ulcerative colitis, may impair movement within the GI system. Lastly, a history of abdominal surgery or trauma could lead to adhesions that complicate gastrointestinal health. Common gastrointestinal system diagnostic studies. Diagnostic studies for the GI system include several types of tests. First, there are imaging techniques and scopes, such as abdominal ultrasound, capsule endoscopy, CT scans, and procedures like endoscopic retrograde cholangiopancreatography, or ERCP, and fiber optic colonoscopy. Next are laboratory and function tests, which include gastric analysis, liver and pancreatic studies, and hydrogen or urea breath tests. For advanced imaging, doctors may use MRI or MRCP, which stands for magnetic resonance cholangiopancreatography. Other procedures include laparoscopy, sigmoidoscopy, upper GI tract studies like barium swallow tests, and video fluoroscopic swallowing studies. Signs of bowel perforation and peritonitis. Key symptoms of bowel perforation and peritonitis fall into several categories. Starting with abdominal symptoms, patients may experience guarding of the abdomen, abdominal distension, rebound tenderness, also known as Blumberg sign, and diminished bowel sounds. They may also be unable to pass gas. Gastrointestinal symptoms often include nausea and vomiting. Systemic signs may present as fever, pallor, restlessness, dizziness, or altered mental status. Vital signs typically include tachycardia, tachypnea, and low blood pressure accompanied by a rapid heart rate. As the condition progresses, patients may experience worsening abdominal distension and pain. Medications to treat inflammatory bowel disease. Medications for inflammatory bowel disease, or IBD, fall into several classes. First are antimicrobials, which include drugs such as ciprofloxacin, clarithromycin, metronidazole, and rifaximin. Corticosteroids are also used, including budesonide, hydrocortisone, and prednisone. Another important group is the 5-aminosalicylates, such as mesalamine, osalazine, sulfasalazine, and balsalazide. Immunosuppressants like azathioprine, cyclosporin, mercaptopurine, and tacrolimus are often prescribed. Finally, immunomodulators like adalimumab, certolizumab, infliximab, and natalizumab are used. The purpose of these medications is to reduce inflammation, suppress immune responses, and control infections. Together, they help manage symptoms and prevent flare-ups in patients with IBD.